All right. Well, everybody, good evening. My name is Ben, and welcome to today's webinar, the 2023 USMLE Step 1 Tutor Series hosted by TrueLearn. Tonight, we'll be kicking off the series with USMLE Step 1 Prep, Building the Foundation. And now we'd like to introduce our presenter, Dr. Chris Carrubba. Dr. Carrubba is the Medical Director of TrueLearn's USMLE Smart Banks and has over 12 years of experience in USMLE and COMLEX tutoring, question writing, and content development. So, Chris, if you'd like to, you can take it over here. I'll switch right to the stage. Mike is yours.
Thank you so much. And thank you, everybody, for coming tonight. I've been looking forward to this for couple months now, really. And, this is just something that I always get excited to talk about. And it's, always such a pleasure to work with people, really starting at step one and just, helping them out along the journey. And, you alluded to my experience here, and, where I'd start is by pointing out, over the years, I've tutored, well over 1,000 students for the USMLE and COMLEX at this point. And in 99% of those sessions, one of the first things that always comes up are concerns that someone is studying inefficiently, that they're not making the most of their question banks, or that they have poor test taking skills. And the bad news is that, yeah, a lot of times those concerns are true, if not, most of the time. But the good news that I found is that they're always fixable. And that's what we're going to talk about tonight. My experience on the USMLE has taught me that anyone can learn how to study more efficiently. Anyone can learn how to maximize question banks as a resource. And anyone can learn good test taking skills that are going to carry you through the exam, and not only carry you through step one, but carry you through shelf exams, carry you through step two, step three, and beyond. And, one of the first things I really always like to bring up is, there are so many ways to do well on the test. And, you can have a great foundation of knowledge, you can have great test taking skills. And when you really start combining that with hard work, efficiency, that's when it starts to really click and feel good for a lot of people. So for our first webinar tonight, where we're going to start with is that foundation, really building the basics, for you. We're going to cover how to make the most out of a question bank, what mode to use, tutor mode, timed mode. We're going to talk about the benefits of subject-specific blocks. We're going to move into some introductions on test-taking skills and things that you guys could start doing right now to make big improvements. And then we're going to talk a little bit about how to study from the question banks, how to really make the most out of each question as an individual learning resource, how to be efficient when doing that. And then as we go with session 2 and 3, we'll really build on those skills. And, by the end of this, you all are going to be, if not test taking experts, you're going to be a lot farther along in that process. And, you're going to really have a great foundation and great skills to go from there. So first and foremost, I don't know where everybody's at in the process of using question banks, and that's okay. Some of you might have already worked through a bank. Some of you might not have even picked one up. A lot of you, most of you are probably somewhere in between. The benefit of banks, if I can't stress enough, is that it's giving you active learning, it's mimicking the real examination, and it's highlighting the most high yield content for you. And those three things sound simple, but they're some of the most important things that you can do. And if you're going to take away nothing else from my presentation tonight, I would hope that it's that you should use question banks, at least one, in preparing for the test. That is how you're really going to make that leap. And I would, even beyond that, encourage you not to delay that process, because I find a lot of times students feel that they need to know too much information to get started. They want to use the question bank as an assessment of their knowledge and not a learning resource. And the longer you're putting it off, the longer you're taking to really get the benefits that are there. And as you move into the question bank, I would tell you, your main goal should be getting through at least one bank entirely, plus a second pass through all of your missed questions. If you have time to reset it and do it again, that would be great, but at least get through the full gamut of the bank, plus a second pass through your incorrects. At the end of the day, you are never going to be able to cover every possible topic that could show up on your exam. But I can promise you the majority of, banks, be it, TrueLearn, Kaplan, Amboss, UWorld, are trying to cover the most high yield material there. As you move into your studying, I would say to always prioritize your questions, especially if you're in your dedicated period. Again, where I see people struggle is that they put their questions to the back end. And the problem becomes that it's always just a little bit more that they need to do. I need to finish this chapter. I need to flip through this, flashcards. And then what happens is they've left themselves 2 or 3 hours to maybe get through the 80 questions that they need. And then as you move forward, as you get further along, I would tell you to consider the benefits of adding a second bank. One thing people always ask, when should I consider a second bank? I think first and foremost would be if you're somebody who still needs to work on test taking skills, but feels like you've memorized all the content from the first bank as you've went through it. One, that's a good thing. If you've memorized everything in there, you're going to probably do pretty well on your test. But in that situation, yeah, you probably will benefit from seeing new questions, new ways of looking at things, especially if you're working on test taking skills and timing. The last thing, and this is really a change since step 1 has went pass fail. And I think one of the benefits of that is that it's allowed you to be a little bit more selective in what bank that you're going to use. And at the end of the day, I think the best bank is going to be the one that fits your learning style. I'm very proud of the bank that we've made at TrueLearn. We've put a lot of work into making that a high quality bank, but I'd be kidding myself if I felt that that was the best bank for every single student on the planet. The same goes for each one out there. If you find that you're giving a bank a shot and you're 50, 100, 150 questions in, and you just don't like it, it doesn't fit your learning style, you're not getting the most out of it, you're having to spend too many times, filling in the gaps, or maybe it feels like it's providing you too much information, don't be afraid to look around. And again, and that comes back to the benefits of starting early. You want to come into dedicated studying very confident in your plan, not starting and stopping new resources for the first 2 or 3 weeks. As we go through this, Ben is going to be here to help take questions, and maybe put some forward to me as we get to little stopping points like this. I'm going to check in with him for 1 second and see if we have anything, and then otherwise we can move on to the next slide.
None yet, so we can keep moving along.
All right, perfect. So answering in some of the most basic questions and most common questions that I get from people. Number 1 would be, when do I do tutor mode versus time mode? What are the benefits of each? In terms of tutor mode, I think it's great for first learning concepts. Again, you'll hear me say it a lot. I think question banks are a learning resource before they are an assessment resource. If you're deciding to start using a question bank for the first time, you're using it as you go along with, class, you're just getting started with questions, I think tutor mode is great. It allows you to go at your pace with each question. You're in that question in the moment, you're doing it, you're reviewing it right there and then. I think that is very efficient for some of the things we're going to talk about later. It allows you to see, why was this question stem sarcoidosis? What details were supposed to point me in that way? It allows you to maybe work on your test taking skills. What detail got me hung up here? Why did I pick answer choice B? Why is that wrong? I think that is very efficient. And especially if you're in a period of time where you're in a time crunch, tutor mode is probably how you're going to get the most amount of questions done while still giving yourself the time to review them. However, there's benefits to timed mode too. First and foremost, for students that struggle with timing, if you know that is you, or you're worried that is something that you need to start doing immediately. I use a lot of sports analogies, but I think back to playing basketball in high school. I was really good at shooting free throws in practice. I was a lot worse when it came to a game situation. I had to stop running. My heart rate was up. I was nervous. People were watching me. Doing free throws with nobody around, just walking up to the line, wasn't helping me. I needed to mimic the game situation. The exact same thing is true for the USMLE. If you're struggling with, applying test taking skills in the moment, with finishing blocks on time, the best thing you can do is start doing timed blocks immediately. Even if you're not that worried about it, it's a great way to start building stamina. It's a great way to start seeing how you do when you might have to string 2 blocks of 40 questions together back to back without much of a break in between. And really, at the end of the day, where I come back to, I think it's best to mix and match. Yeah, there are going to be people that do it just tutor mode. There will be people that do it just time. I think the reality is that you can find a way to marry the two, and that's where you're going to get the most benefit out of that. The other thing that kind of ties into that is subject specific versus mixed blocks. And what I mean by that is subject specific would be you going and setting your block up to do nothing but cardiology questions today. And you could be even more specific than that. I could do nothing but cardiac path, nothing but cardiac farm. You could, again, blend it a little bit, and maybe it's cardio and respiratory. On the other hand, mixed is going to be really just doing a hodgepodge. I'm going to select everything. I'm going to allow all of that to come in. Again, what you see with the column on the left, I think subject specific is a lot easier when you're first learning, and it's a lot easier if you're trying to study while you are in classes. Depending on where you are at, there might be a scenario where there's just content you've never even learned for the first time. And I think that can be a barrier for students a lot of times. Other benefits of subject-specific learning, it allows you to focus on areas that you know are weak, especially if they're high-yield areas. And it can allow you to really see the subtle differences between why a question is right or wrong. And, it can allow you to see, why is this question, the answer was heart failure with preserved ejection fraction, but this other question, it was high output heart failure. And you start to notice some of that subtleties. That being said, it's predictable and it doesn't mimic test day. And in tutoring sessions with students, when they want to do subject specific blocks, very frequently I could hear them say something like, well, I don't know why B is wrong, but it's a renal disease. And I know this is a block of cardiology questions, so I can eliminate. You're not going to have that benefit on the test day. What benefits you the most on test day is mixed question. It mimics what you're going to see, bouncing between cardio, embryo, respiratory, renal, and so on. It also helps you get spaced repetition as you study. If you're someone who is in subject-specific mode all the time, you might go days without seeing a certain type of material. You're not going to see that with mixed. The downside, I think mixed can require a little bit more efficiency and discipline from people. If you're someone that has a hard time bouncing, in between resources, you need to look a lot of stuff up. That's going to slow you down. And then it can be very challenging for students with large knowledge gaps. And, again, at the end of the day, I think you should mix and match. I think when you're at the beginning of your study period, you're going to benefit a lot from tutor mode, a lot from subject-specific blocks. As you move over towards the end, I think that's where you're going to benefit from timed mode, and that's where you're going to benefit from, mixed blocks there. Another big thing on this, again, something people always ask me, how many questions should I be doing a day? And again, first and foremost, there is no uniform answer here. For some people, that might be 60. For another, person, it might be 120. What you have to find is what's the pace that allows me to meet my goal, finishing this bank, doing the incorrects, maybe even more than that. And you have to find a pace that allows you to balance quality with quantity. I would always rather a student I work with do 60, 70, 80 questions a day, and they are doing them, they're working hard on them, they're reviewing them in a quality way, than see them do 120 questions a day, but most of those are being reviewed very quickly and they're missing a lot of the learning objectives. The other thing to remember, just like anything, you can add more as you go. When you first start out running for a marathon, you don't start running 20, 21 miles, right away. You build that up with time. So I would encourage you, start lower and work up as you see the ability, both in terms of your stamina, the amount of time you have available, and just your ability to review those questions in a good quality way. Some pitfalls that I see when working through the bank, avoiding material you dislike. I get it. Biochem, biostats, some of that stuff sucks. It's easy to want to push that thing off until the end. I think you can do that sometimes. You can pick something very narrow and say, I'm going to really focus on learning my equations the last, 1 or 2 weeks before my test. The problem I see is that people start lumping in way too many things in that. And then it becomes my equations, all the biochem pathways, all the inborn errors of metabolism, so on and so on and so on. Going along with that, and maybe the other side of it, is people become very fixated on one bit of material. And I think cardio is really important. So I'm going to spend 7 straight days on that and not move on. And, I'm not going to do anything before I feel like I have pharmacology down perfect. And the problem is that even if you learn it really well by the end of that 7 days, you're going at a pace that is going to prevent you from seeing it again. And when you take your test 8, 9, 10 weeks later, however long, a lot of that material that you did know really well is going to go away if you're not giving yourself a chance to review that. And, then the last problem just becomes that you just have way too much to do at the end. And, that's where you might see somebody feeling like they have to push their exam back, or they're going into test day not feeling very confident because there's so many other things there. Again, going to pause here really quick to see if, Ben has any questions he wants to feed in, and otherwise we can kind of move on to the, breakdown portion of this.
Yep, we can keep moving on and let you know when their questions come up.
All right, perfect. So here's the part today that I'm honestly the most excited to talk about, and this is going to be just an intro to breaking down questions and really learning from questions. And as we flip over here, this is a sample question that I wrote that's in our Step 1 bank. I'm going to give you all maybe 1 minute to kind of try to read through this pretty quickly. Just take a chance, read through it, and do it your way, how you would approach this question if it was your test. I'm going to take a quick drink, and in 45, 60 seconds, I'll come back and we can move forward. All right, give you a couple more seconds to finish reading here. And all right, so to me, it's a very standard USMLE question. Very likely that you're going to encounter something on this specific topic on your test, pretty in line with the length, the style, the answer choices, that you're going to see. One thing that I wanted to point out here, and it's not in our slides at the moment, but I'll come back and add it, is just for education on people. You often hear people talk about a first order, second order, and third order question. And this to me would be kind of that second order question. So first order would be asking something very direct. It would be if we said, which of the following is the most likely diagnosis? And we listed, real diseases for each answer choice. A second order question would be something that you're seeing here, where we're asking you to, in your head, make the diagnosis, and then you have to do a, secondary process. What's the pathophysiology of that? Third order could be something that takes it even farther than that and says, what would be a disease that shares a similar pathophysiology? And you've made, more and more steps along the way. Obviously, the further it gets, the more challenging it's going to be. And I think you'll see as we go along, that's why, learning good test taking skills is helpful. I think one of the first things that you want to start doing is finding a way to approach questions that is the same every single time. This is how I like to do it. Through the years, I've become a big fan of starting with the last sentence first and briefly looking at the answer choices. The reason I do it, first and foremost, it saves time. It's not always going to be the case, but you will sometimes see a pseudo stem. You might see a question where they say, the patient is started on digoxin. What's the mechanism of action of that drug? If you're someone that struggles with timing, that's just saved you a ton of time. You don't have to read anything else before you move on. It also gives you a chance to frame the question. I can look down and get a feel for what I need to do here. Here, I can look down and I can see, okay, it's going to be a second order question. I'm going to have to figure out the diagnosis on my own. Then I'm going to have to figure out the pathophysiology. I can also get a feel that this is most likely a GI hepatology question. It's kind of put me in that mode where I almost have some spoilers. I know what I need to look for here. And by evaluating the answer choices themselves, I can even start to think in my head, okay, what might be the key details here that I need to look for? And as I'm reading the STEM, then I'm more likely to even realize, hey, that detail helps me eliminate answer choice C. That detail really fits with answer choice D. And I'm being a little bit more of an active test taker compared to someone that is starting at the very beginning, waiting till the end, and then they're having to think about things for the very first time. That being said, two things. One, you don't want to spend too much time doing this. If you're having to look at an answer choice and you're spending 2 or 3 minutes trying to think about, what that might correspond to, you've spent way too much time on it. And secondly, this is not going to work for everybody. There are people that, despite trying it and giving it their best shot, just don't like this way of doing things. I think for anything in life, you will never find one uniform path to success. So I think, does this help the majority of students? Absolutely. But if you get in and you start trying it and you don't like it, don't be afraid to recognize that it's not working for you. And I would just encourage you to find a different way to do something and stick with that from there. One of the things that I really like doing for the second and third order questions is I like trying to convert the answer choices in my head. And again, that's going to help me because it's going to help me figure out what's important as I go. You can see how I would have done that here with, if I was working with someone in a tutoring session or just taking the test, by myself. I can look at answer A and say, okay, that seems to correspond to alpha-1 antitrypsin deficiency. B is Wilson's disease. C would actually be nothing. It's just more of an inaccurate description of hereditary hemochromatosis. I'm moving on. I can see non-alcoholic fatty liver disease, secondary hemochromatosis, and hereditary hemochromatosis. As I go up, now I can start looking for those details that jump out to me. Boom. Okay, it's a 51-year-old male. All right, right away, I've noticed that's kind of in that 40 to 60-year-old range that somebody with hereditary hemochromatosis, might present at there. I can say, hey, that's actually a little bit older than somebody with Wilson's disease comes in with. Moving along here, I see, diffuse joint pain. Hey, that's a feature that goes with hemochromatosis. Fatigue, loss of libido. Again, hemochromatosis. I can see, type 2 diabetes, mellitus, started on metformin. And you're seeing that I'm really highlighting those details that I go. Even if I wasn't feeling that confident with it, I still think highlighting is very helpful. It really lets me focus on the key items that are there. And what I'm trying to focus on is, maybe anywhere from 4 to 10 things that feel like pertinent positives, pertinent negatives, relative to the answer choices that I know exist. And for me, it's always helped me kind of keep an eye on what's going to matter. What are the things that I can use to rule an answer in, rule an answer out? It also helps me in a situation that I feel like I might need to reread the STEM. I mean, even for me, I have a lot of questions where at the end, I'm not 100% sure what the answer is. Rather than going back up and rereading the entire thing, you could see how I could reread this. 50-year-old male, 2-year history of diffuse joint pain, fatigue, loss of libido, recently diagnosed with type 2 diabetes mellitus, yada, yada, yada. In doing it that way, reading nothing but what I've highlighted, I've been able to come up with the correct answer and, get that. And That's something I would encourage you to think about as you practice highlighting. Look at it and say, if I read nothing but what I highlighted here, would it have been enough to get me to, the correct answer choice? Was it too little, or was it too much and it was overwhelming and, not even able to, help me out there? Another thing that I try to do, and we're really sticking with the same question to try to, hammer home this concept, is I always try to make things as as direct of a question as possible. And there's a lot of educational research that has went into just proving that when it comes to standardized tests or anything in life, we do a lot better when we are asked direct questions. If my wife were to ask me, how do you make your recipe for eggplant parmesan? That's a lot easier to answer than how did you make that recipe for dinner? The more direct of a question, the easier it becomes. So what I try to do, if I can, is to convert things over to where I'm saying, instead of what's the underlying cause of the patient's symptoms, I'm saying in my head, hey, I recognize the diagnosis. What is the underlying cause of hereditary hemochromatosis? You will not always be able to do that. Sometimes you're going to read through it and you are not going to be certain about that. In that situation, what I'll instead switch to is focusing on the important variables that I have to explain. And just like we talked about when highlighting, now I'm saying, okay, which of the answers can fit this age range, the duration of symptoms, the specific symptoms themselves, the exam findings that we're seeing. And that becomes, very helpful for me because, what I can do from there is move into process of elimination. And I can start saying things like, hey, 51-year-old doesn't really fit with, Wilson's disease. Those patients usually present by age 40. The new onset type 2 diabetes mellitus really tells me that there's probably an issue going on in his pancreas. So I can eliminate answers there. The patient has anemia secondary to beta thalassemia minor. Well, you don't get transfusions, for that, and so on. So focusing on those details and just using that can be very helpful. Another thing you can do, take a step back and ask, what do I actually know about these things? We look at the answer choices again. I'm asking myself, okay, what does a question about alpha-1 antitrypsin deficiency look like? Well, it's usually someone that doesn't smoke and they have, emphysema and, liver disease. Maybe there's some family history mixed in. For Wilson's disease, it's, mostly liver and neuropsych manifestations. I think a lot of times, and again, this is the benefit of question banks, being able to see how the test works, how they present things. If you can think back and say, well, what does this disease look like? What do I see when I get this question? That can be really helpful for you and can be very helpful for eliminating answer choices, especially once you've went and listed out the variables that you need to knock out. And that's where I can finally move into process of elimination. If it's a hard question for me, this is what you're going to see me do. And I always try to go through the answers like twice. My first time going through, my goal is just get rid of answers that I know are wrong. And the way I'm going to do that is if I can easily eliminate it, it's gone. If I can't, we're going to keep it for now. So on this one here, here's a perfect world scenario where you could go through and say, okay, alpha-1 antitrypsin deficiency is out. This guy doesn't have emphysema, and it wouldn't be able to explain his diabetes or joint pain. Wilson's disease, he's too old, no neuropsych symptoms, couldn't explain the diabetes. Disease gone because it's not an actual disease mechanism. Fatty infiltration of hepatocytes, unlikely because he has a normal BMI. It wouldn't fit the patient's family history that was mentioned in there. Frequent blood transfusions doesn't work because you wouldn't get blood transfusions for beta thalassemia minor. And then we are left with F. And even if you weren't 100% certain on that, sometimes maybe the best thing you can do is just pick the answer that you can't rule out. And we'll talk about that more in sessions 2 and 3, but at the end of the day, nobody knows why you got the question right. And getting it right because you 100% knew it versus getting it right because you're a good test taker looks the same to, the score of the exam. All right. Now we're going to move into just quick, go ahead.
Oh, yeah, let me just chime in. We did have a question, which kind of goes back a little bit to some of the earlier part of the presentation. Would you recommend reviewing a subject, for example, reading a first aid chapter before doing a 40-question block, or reviewing them after a question block?
Yeah, it's kind of a multi-part question. I'll try to get through the answer here as directly as possible. I think there's probably a couple caveats that I would add. First would be, I think a lot of it depends on where you're at in your studying. Again, if you're in classes or you're at the very beginning of your study, dedicated study period, I definitely think it can be helpful to read beforehand. Especially if you are someone who has a hard time viewing this as a learning tool and maybe gets down on yourself. I mean, we all do that, and that's okay. And I think recognizing that, hey, I'm not going to get the most out of this if I haven't done a little bit of pre-reading, if I haven't went through the material. As you move further along, ideally you would not be doing that as much. I think as you move along, you do want to start using it as a little bit more of an assessment. So I would try to get away from reading. The other thing you want to remember, and the question kind of said something about reading at the end. And one of the things I talk about with efficiency is avoid being redundant. And we'll hit this on a few slides later, but one of the biggest issues I see for people is they'll do a question, they read all of the text of the explanation, the wrong answers, all of that, and then they flip to first aid and they almost end up reading the exact same thing over again. You want to trust, again, a good question bank. We've spent a lot of time on it making this one. We are trying to give you everything you need for that specific question. So a lot of times you're reading back and it's like, you're using first aid and it's almost basically being like, yeah, if I would have known all that, I could have gotten the question right. But what you're really doing in that moment is reviewing the same thing that you just read. And we can talk about some strategies for avoiding that in a little bit on the presentation, but it is something that I think you want to keep in mind, as you're going. But, the best answer I can give is if you're at the early part of your studying period, just getting started, you might be a little, more benefit out of reading before you do questions. If you're getting closer to your test and you've had that first pass through all of the material, I think you're going to be in a position where you should probably do the reading after, going through the questions, and maybe just focus on what you actually need to study. Any other questions?
That's all for now. Thank you.
All right. So couple other things that, that just commonly come up when I start working with students. Again, people say, do I need to memorize the reference ranges for laboratory studies? How do I work through lab? So in terms of reference ranges, I'll be honest, I've done this for over a decade now, and I still haven't memorized most of the reference ranges because they're there for me. And the biggest fear for me, I'm thinking back to when I was studying for step 1, someone told me that I had to do this for time. And I found two things. Like, one, again, I was spending a lot of time trying to memorize something that the exam was going to give me. So it didn't feel very efficient. And two, I didn't want to miss a question because I made a mistake doing that. So what would end up happening is I would go and check it anyway. So I think as you go, you are certainly going to memorize a lot of stuff that you see over and over again. And there are things you have to, I have to know that MCV of 80 to 100 is normocytic, less is microcytic, greater is macrocytic, all that. But I think you are better off spending your time on other things. And even if you do feel like you've started to memorize a lot of the reference ranges, when in doubt, look it up. I mean, you don't want to miss a question for something that you could have easily taken 1 second to reference. Instead, what you're better off doing is use your question bank to learn where those variables and values are. And as long as you've practiced, you're going to be efficient on test day, and it's going to be a fraction of a second for you to go look that up. Another thing people tell me is just, hey, I get really overwhelmed with labs. And, the more they give me, the harder it is for me to work through. What I tend to try to do is highlighting pertinent positive and negative results that are related to the question. Again, that kind of requires that I've went down, I've looked at the last sentence, I've looked at the answer choices, but you can see that I do that here, in this question, moving through it a little quickly. We have a pregnant patient, with with right upper quadrant pain, blood pressure's up. I want to go through and look at these labs and say, okay, I see she has anemia. I see my reticulocytes are up. That's going to be really helpful with some of the answer choices, that I've got, and can help me knock some things out. The leukocyte count and the platelet count are normal, but that matters because one of my answer choices down here, bone marrow dysfunction, would be aplastic anemia. So again, I find highlighting the positives and negatives that are going to be related to my answer choice can make me a lot more efficient, there as I go through that. So that's a skill there. Any quick questions on laboratory studies?
None for laboratory studies.
All right. And again, biggest thing on that, just practice. The more you practice looking through these, the more you practice highlighting and incorporating them into your answer choices, the better you're going to be. And we're going to talk about that again, as we go into, webinars 2 and 3. As you move on to, I always encourage students to start using little rules to keep them from making mistakes and to push them along in the right way. And, we'll hit a lot of these as we go through the next few webinars, but, here's an example of that. Whenever I see someone has a low bicarb, I'm always going to stop and calculate the anion gap. I know that's probably going to be pretty helpful for eliminating answer choices in the differential diagnosis. Similarly, when I see a elevated creatinine, I'm always going to stop and calculate that BUN to creatinine ratio, because I know if it's greater than 20, it's pre-renal azotemia. If it's less than 20, I can think about intrinsic disease. One note on that, that's something you can often do really quickly if you just round up to whole numbers. So here I just round 1.9 up to 2. 2 times 20 is 40. So if the BUN is greater than 40, I know it's pre-renal. If it's significantly less than 40, I know it's more intrinsic. Again, you don't have to do it that way. There is a calculator in the exam software. So when in doubt, use the calculator and make sure you're getting it right. For me, with ABGs, I encourage people to always try to verbally interpret what you're seeing. Look at this and say, okay, I've got a low bicarb, a low pH, a low PaCO2. That's telling me I've got metabolic acidosis with respiratory compensation. It kind of comes back to what I was saying about making questions as direct as possible. The more I can actually be direct in how I'm interpreting laboratory studies, the better I'm going to do with that. The other things you want to do is say, for certain topics, I want to look at these specific variables because they are going to help me answer the question. We look at this one here, and the question is asking down at the end, what's the pathophysiology causing anemia in this patient? I know with anemia questions, I always like looking at the MCV. Telling if something is microcytic, normocytic, macrocytic is usually going to let me eliminate 2, 3, sometimes even all of the wrong answer choices. If it's there, I always like looking at the other cell lines. Are they normal or are they low? Again, that can be helpful for looking at aplastic anemia. They're all low. Or in this situation, I see that the platelets and the leukocytes are normal, so we can rule that answer choice out. If it's provided to me, I always like looking at the reticulocyte count. If I see a high reticulocyte count, I know I'm usually looking at more of a hemolytic picture. If the reticulocyte count is low, then I'm in a situation where I'm either deficient in the precursors to make red cells, iron, B12, etc. I don't have EPO telling my kidneys to make, or EPO from my kidneys telling my bone marrow to make red cells. Maybe I have dysfunctional bone marrow. It really helps. So if we look at this question here, not even really reading anything else that's available to me, I can go through and say, okay, this is a microcytic anemia. So that means that I can get rid of, any answer choices that correspond to hemolysis. The reticulocytes are low. I can get rid of that. And just having those rules can be really helpful as you work through these questions. Another,
Dr. Carrubba,
yeah.
Dr. Carrubba, just a couple more questions that came up. One more general, one specific to the lab studies. So about the lab studies, how do you tackle a question with a long stem and many lab values?
Yeah, I think to me, this is really where you want to start practicing, and you just need to build that efficiency. The biggest, again, I hate acting like it applies for everybody, but I just really can't stress the benefit of starting at the end, knowing what you're going to get asked, and having an idea what the answer choices are. Because by being aware of this and being able to look at this question and say, okay, A is talking about a sideroblastic anemia, B is talking about autoimmune, hemolytic anemia, so and so and so on. I'm able to go into that question, and it really tells me what variables are going to be important here. And I think knowing that allows me to move a lot quicker, because it's easy to see, what doesn't matter here. And again, as I move into the labs, it also just makes it a lot easier for me to go through and say, okay, these are the values that I know matter. As I see this value in my head, I'm able to cross out this specific answer choice. So that to me is just the benefit of building a good test taking strategy and a good mental bank of what are the things that are going to get tested? How do they get tested? What are the variables that I need to think about as I move through? And the last part of that to me is highlighting, being able to highlight, these are the details that are going to be very helpful for me. And that I can work through there. Anything else,
Great,
Ben?
thank you. There's one more question, but since it's more general, actually, I'm going to leave that for the end.
All right, sounds good to me. All right, so moving away from laboratory systems, and again, we are going to come back to so many of these principles for webinar 2 and 3. It is not possible to cover all of this stuff sufficiently in a 1-hour period. And, again, the goal for today is to just establish that these are things that you want to start doing. And, as we go to sessions 2, 3, and really as you all start practicing on your own, that's where I think those skills are really going to come in. Thinking about media samples, again, practice doing this and practice good test taking skills for it. Media samples are really going to be things like biopsies, x-rays, etc. that show up. Keep in mind that while important, they are just one variable that you want to account for. And a lot of times there will be other details in there that allow you to answer the question correctly. Don't get tunnel vision for just the media sample. I can't tell you how many times someone has said, well, all the details in the question stem tell me that it's this answer, but I don't know, maybe the media sample is showing this. I'll go pick that instead. Look for ways to make everything fit. And at the end of the day, if the stem is telling me this, go with what that tells you and don't guess based on the media sample. Another thing that you'll notice is that they will often tell you what the media sample is showing, and they're just including it in there. That's not a trick. It's not like, oh, chest x-ray shows consolidation in the right middle lobe, and we're not mentioning the massive tumor in the right upper lobe. They are telling you what you need to know. So in that case, you could honestly not even look at the image if you didn't, want to or didn't have the time. An example of that's over here. We look at this question here, and I'm supposed to look at this and realize that I'm looking at a hypersegmented neutrophil here. But I can look back and see that there's already a lot of details that are going to point me towards the correct answer choice. I see that it's a macrocytic anemia. So I am, right away able to narrow things down, a lot from there. I can use the patient's risk factors to narrow things down. I can use the timeline of the question things to STEM to narrow things down and really get to the correct answer without even understanding what I'm looking at here. The same thing is really being highlighted on this slide as well. And, it's certainly nice to be able to look at this and say, oh yeah, I'm seeing a lot of lipid accumulation. It's A beta lipoproteinemia. However, there's again, other details. I can use the age to rule answer choices out. I can use simply them telling me where the biopsy is coming from. I know someone with cystic fibrosis is getting steatorrhea and failure to thrive from pancreatic insufficiency. So just the fact that it's a jejunal biopsy helps me narrow, answer choices away. And then, again, they don't show that many normal biopsies. So that even helps me there, just saying, hey, would they even be showing me, the biopsy here for this condition? And you can see the same things in these other slides here as well. And that would just be something that I would encourage you to practice doing. Always review, did I even need the biopsy to answer this question? Were there other details that could have really helped me there? And a lot of times you'll find that, even if the image is necessary, you can sometimes do something with it, even if you're not 100% sure. Chest x-rays for me are a great way to highlight that. So even if I wasn't certain here, I could just say, hey, this is a unilateral issue, and I could go and eliminate any answer choice that I know causes bilateral disease. That might not be enough to get me to the correct answer, but that plus maybe one or two details in the question stem certainly might, or at very least, it puts me in a position that I can guess correctly. Similarly, when the media sample is an illustration, I'm going to always try to verbally state what's going on. I can look at this one here and just, it's kind of a, basic science question. And I can say, okay, what they're talking about here, AGM is a marker for angina in mice. The concentration goes down as the dose of L-arginine goes up. Since AGM is a marker for angina, its decrease in response to the increase in L-arginine suggests that L-arginine could be doing something that combats angina. For me, putting that into kind of a verbal, idea was always just very helpful there, because then I could say, I know that I need to pick an answer choice here that would actually lead to an improvement in angina. That gets me down to A or B. And then I, would have to know from there that B is the only one that's factually accurate. And the last thing I want to go through here is just learning from the question bank and how to make the most of that. And the biggest mistake I see is that people think that there's just one little tiny thing. This is the fact that was being tested, and that's it. And I think there's really, with most questions, 5, 6, 7 things that you can benefit from. And the way that I do that is I always start with asking myself, what did I need to know in order to answer this question correctly? So we go back to that hemochromatosis question, and I needed to be able to recognize that this was a presentation of hemochromatosis, and then I needed to understand its pathophysiology. Those were the two things that I had to be able to do. And then for one that I missed, I can flip that back around and I can figure out why I missed that question. And the reasoning for that is I should be studying completely different things based on why I missed it. If you knew that this was hemochromatosis and you just didn't know the pathophysiology, you can largely skip that first step. That wasn't my issue. I need to just focus on the pathophys here, versus somebody who said, I had no idea what was going on. I didn't even understand the answer choices. That person should be spending a lot more time reviewing this question. They should be focusing on different things. And what you're trying to ask yourself as you go is, were there knowledge gaps for me? Did I have misinformation? Maybe I thought that Wilson's disease was the one that impacted your pancreas? Did I have test taking issues? I got really hung up on the fact that they said beta thalassemia minor and I couldn't move along past that. Anything like that. What I'm trying to do there is gain insight into why I missed that question, because that is what lets me take the steps to make sure that's not going to happen again. And it's what lets me do that in a very efficient way. As you move on and you become more efficient, you can start asking yourself these other things. How could they have changed this? Maybe they could have focused on different details for hereditary hemochromatosis. We know that those questions are not always going to look the same. I'm going to ask myself, do I understand the wrong answer choices? Was I able to put them to the correct disease? Was I able to, really understand why that was wrong or what would have made it right? Can I improve the way that I, do test taking? Could I have done process of elimination better? Could I have highlighted better? And then I'm asking myself, are there buzzwords that I need to learn? Maybe I need to realize that, anytime you're telling me someone has type 2 diabetes, but they have a pretty normal BMI, that should be a red flag for me. That should make me think, like, that doesn't really make a lot of sense. I don't see that very often. Maybe this is, hereditary hemochromatosis. Maybe it's a glucagonoma. Those are really the two things that do that on the USMLE exam. I can also ask myself, is this something that I need to work on more? And this really ties back to, the question that was fed in. And, this comes down to just some common mistakes that I see people make. And again, we're going to come back to this on webinars 2 and 3. People trying to learn too much instead of focusing on just the learning objective. The example I give is, this question was about recognizing AFib on an EKG, and then someone spends, an hour also covering the pathophys of AFib, the risk factors, the treatments for it. You want to trust that your bank is going to carry you through that, and you will get other questions that cover those details. You can't learn everything at once. Instead, focus on what the learning objective is. Leave that stuff for, later. I see people taking too many notes all the time. They're almost rewriting that entire explanation header that they're going through. They're, rewriting everything in the wrong answer choices. That's inefficient. You would be better off going at a pace that lets you see things multiple times. They're using too many resources. They've got, first aid open. They've got a deck of flashcards open. They'll flip over to, their video on, Sketchy. They're just bouncing between too many things. And then, the last two would be spending way too much time on low yield material and always attributing everything to a knowledge gap and not recognizing, opportunities to, help with test taking. And, moving through just some strategies on this, in terms of trying to learn too much, I would try to keep your review on each question to about 5 to 7 minutes. Set a timer if you have to. Really focus on, in that moment, learning, just the learning objective. And what I did to help myself, I would have a piece of paper next to me, and I might just write down things that I felt like I needed to review at a later date. Also, keep in mind, you really, the best performance comes when you learn in stages. I'm going to build my foundation. Then I'm going to add a little bit more. Then I'm going to add a little bit more. That's a lot more efficient. It's going to get you a better score. And a lot of times what I would find with my list is that by the end of the day, I might have seen other questions that knocked items off, or I might have been able to, eliminate a wrong answer. And I'm like, oh yeah, I actually do understand this concept. It made me a lot more efficient as I went through there. And I trusted, and I encourage students I work with, trust that the other questions will get you that material that you need there. This question that we did was focused on presentation and path of hemochromatosis. Don't use it as a chance to focus on treatment. Similarly with note taking, if you're writing down every single sentence, you've got 2 paragraphs for each question, I would ask, are you even giving yourself time to go back and look at those notes? And most of the times people say no. So what's the point? Instead, if you really have to take a note, I would tell you to try to keep it at 1 to 2 very high yield bullet points per question. For this one, it could have been hemochromatosis presents like this, yada, yada, yada. The pathophys involves this. And maybe you could even throw a third note in on a test taking type skill. Hey, for the purpose of the USMLE, if I see new onset type 2 diabetes in someone that's not obese, that should really be a red flag, for this. In terms of resources, try to just stay in your question bank when you're doing it. Use that list to indicate what I need to go look up in first aid later. When you start bouncing back and forth, you're really going to see a decline in your efficiency. And I just don't think the return on investment is there. And then the last one here, really high yield versus low yield content. What you'll notice with question banks is that they're going to give you a percentage correct. Especially when I'm in the early stage of my studying, and again, with step 1 being pass fail, I can look at something where only 34% of people answered correctly and realize this is more low yield content that's not going to make as big of an impact on my score as is this question where 55% of people answered correctly. So there's no perfect science to this, but I would always tell you that as you're first getting started, really spend your time on questions you miss that you see more than 50% of people answer right. And as that number climbs, then I really want to spend it. If I miss that question that 80% of people answered correct, I really want to get that topic down. And likewise, I'll even use the percentages on the wrong answers sometimes and say, hey, a lot of people picked this. Why should I, look at that there? And brief preview of what we're doing at our next one, but I do want to leave a little bit of time left over for some questions. So, I'll turn that over now.
Yeah, thank you, Dr. Carrubba. We do have a few questions. Some of them are kind of related, so maybe I'll just group them a little since we're a little close to our.
And I'm okay if I am
here
over a little bit. I'm happy to answer some questions as we going over.
Sure. Okay. So the first question is, first couple of questions I think are kind of related. What's the best way to build a great foundation? How long does that take? And what material should I use besides question banks? So both these questions are dealing with how do you build that foundational knowledge and what resources should you use for that?
Yeah, and I always hate saying it, but it really depends on you as a person, where you're at right now, how you learn best. In terms of building a great foundation, I think the best way to do that is to really start practicing the things that we're doing here. And that's why, again, I said at the beginning, if the one thing you take away from this is start doing questions right now, that would be awesome. And again, we're going to hit a lot more of these skills in webinars 2 and 3, but even if you could just go back through these slides and start practicing these little things, I think that's going to get you started. And I think that even the people that tell me they are the absolute worst test takers, usually within a 1 to 2 or maybe 3 week period, can start making improvements if they're willing to try and if they kind of stick with it, maybe past that initial learning curve. In terms of resources, it really comes down to the individual person. I know people who have done very, very, very well doing nothing but question banks. I know other people who have done well integrating other resources, in. I think first and foremost, don't use something that hasn't worked for you in the past or that you don't think works for you. Flashcards is the big one for me. And there are students that really, really benefit from flashcards. They're great for spaced repetition. It's a good way for them to learn those kind of nitty gritty memorization facts. But there's other students that just don't like learning that way. And, I'll have people say, hey, I spend so much time on flashcards and they don't really help me. And I've been doing it for a month and I've just never liked it. Then don't do that. I think have the confidence to say, there are certain things that are going to work for me. There's certain things that are not going to work for me, and be willing to move on or be willing to never even go there if your previous experience has taught you that it doesn't work for you. That being said, I think a great starting spot for the majority of students is going to be, a question bank of their choosing first aid for step one, plus or minus a flashcard deck, plus or minus a video series that maybe walks you through some of the memorization based content out there. There's a few options there. Picmonic comes to mind. Yeah, that would be my very generalized answer there.
Great. We have a few more questions since we're at the end of the hour. I'll just cut it off for questions there, but get through the ones that we still had. This one's related. But the next two are kind of related, so we can group those together as well. So this is similar to what you're talking about before. When reviewing questions, how to gauge whether reading the explanation is enough of a review versus going towards outside resources beyond the QBank. And then relate to flashcards too, specifically, do you recommend making or unsuspending Anki cards for incorrect questions, which again relates to using flashcards, using outside other resources with question banks.
Mm-hmm. So, I'll speak for our bank first and foremost. I think when I'm writing a question for TrueLearn or reviewing a question for TrueLearn that another author has made, my goal is that, not even goal, like my rule, that question is not getting accepted and put into our bank unless the explanation is covering every detail that is necessary for someone to answer correctly. I can't speak for other banks out there. I think there certainly are ones that are good, but I think if you are using a bank and you don't feel like it is doing that for you most of the time, then I would certainly encourage you to move to a different one. If you find that you never feel like it does, no bank out there does, not UWorld, not TrueLearn, not Amboss, I would kind of encourage you to maybe have a little bit of introspection and ask, and maybe I looking for too much here. And I certainly see that a lot with people, is that they are the one that feels like they need to know too much. I come back to the hemochromatosis one, and they say, well, this question didn't really talk much about treatment. It didn't even bring up treatment in the explanation. Well, what was the learning objective? To answer it correctly, I needed to recognize the presentation. I needed to know the pathophys. And I think that's where you have to trust that if this is a good bank, it is going to cover the material that I need in order to do well. And you're going to have to roll with that, because if you're always stopping to go and look that stuff up, you're just going to be going at too slow of a pace to really benefit. And that's not going to be true for everybody. There are going to be people that do the opposite of what I'm saying and probably do very well. And that's great, because again, not everybody falls into one nice box. But from my experience doing this for so long, that's what I've seen. And a lot of times it's just you driving that feeling of there's not enough information there. And again, we can't put everything there. There are a lot of details for any one condition. If to describe the pathophys of hemochromatosis in complete detail would take 3, 4, 5 pages. And instead, a good bank, like when I'm writing a question, I'm making sure that we have enough information there so that a reasonable USMLE question, it would cover it, plus a little bit, more. So I think sometimes you also have to remember that you're trying to learn the high yield details right now, the details that will show up on the test, and not every single possible nitpicky detail about a condition, because again, that's going to be too much to do, and too inefficient there. In terms of the flashcards and doing that, again, I think how you make those notes really comes down to you as an individual person. I've certainly seen people do flashcards where they might write on one side, patient with type 2 diabetes and a normal BMI, backside. Think, hemochromatosis or glucagonoma. I would encourage you that if you're going to go the flashcard route, try to make little prompts, because it might seem easy to you in the moment, but 2 weeks later, you might kind of forget where that's going. So instead, what I might say is, if I see a patient with type 2 diabetes, a nuance of type 2 diabetes, but a normal BMI, what diagnoses should I think of? That might make it a little bit more likely that I remember what I was trying to get. Alternatively, I've seen people make bullet point lists on Microsoft Word or, whatever, and that's what they do. And they just, maybe they set aside an hour each day and they go through that bullet point list. And as they feel like they really get something down, they delete it. That's what I personally did. I've never been a big flashcard fan, but for me, just having that list and, whether it was, maybe riding my bike on the trainer, making breakfast, whatever, I could just kind of flip through my bullet points and be like, okay, and, move on. And I made sure that those bullet points, if I put it down on there, was really something that I felt like I didn't understand yet. And I felt like really correlated to a learning objective on the question, not some just, random piece of information that was unlikely to be tested.
Thanks, Dr. Carrubba. Yeah, we'll do one more question, and then I've taken note of some other questions, so we can handle those in the next session. But let's just do the final question for today, which is, for people, the student in particular is taking both COMLEX and Step 1. They said it was recommended that they switch between the question banks. Do you have any specific recommendations for people taking both COMLEX Level 1 and Step 1?
Yeah, it's always a little tough. I mean, you definitely have to do both because there's going to be questions on COMLEX that are not going to be covered on, just a Step 1 bank. I think we've done a good job blending the two at TrueLearn. I think other banks have done that as well. I think in terms of switching, probably the strategy that I've seen work best is really trying to get through a full USMLE bank and a full COMLEX bank. And the reason I think you want to do both is they're just such different tests. And the biggest thing you'll notice with COMLEX is that the questions are a lot shorter and you have to get used to answering on less information. And it can go both ways. Like the kids that get used to just nothing but USMLE questions and want that to carry over to COMLEX can sometimes become really overwhelmed when they're suddenly encountering questions that are a lot shorter and make you do a lot more inferences. The flip side would be someone that gets very good at doing COMLEX questions and then tries to switch over to USMLE near the very, very end, can oftentimes become overwhelmed by all those excess details. I think you need to take a step back and look at when your specific test is. If you're somehow in a position where you're giving yourself several weeks to, let's say you're taking the USMLE and then 3 weeks later you're going to take COMLEX. I think that I would spend a lot more time, front loading my COMLEX questions and maybe giving myself 2 or 3 days that I'm going to look at the USMLE, vice versa if you're going to use the other order. If you're in a situation where you're going to take them very close together, some of the things that I've seen work for people, again, just making a day-to-day breakdown from the beginning. And I'm going to use, 3 days of each week on COMLEX, 3 days on USMLE, or even just doing splits within the day. I'm going to get through 100 questions a day. 50 are going to be COMLEX, 50 are going to be USMLE. One place where I think that you can save a lot of time is in the review. The question stems are very different, but the content that you need to know is very similar. So if I know that I've, reviewed hemochromatosis and I've got that down, I might be a lot more quick to skim through it on the second question bank that I'm working through. And that, again, kind of the basic flyby answer, but those would be some of my tips for that.
Great. I think that will wrap it up, at least for tonight. So again, thank you, Dr. Carrubba, and thank you everyone for attending Build the Foundation Session 1 of the 2023 USMLE Step 1 Tutor Series. Couple final notes as we kind of head out. Within 24 hours, everybody will receive a follow-up email containing a replay link to tonight's recording session, or tonight's session, along with an option to download the slide deck. We had some questions come in about that. That will be available. Additionally, this email will contain an exclusive offer code good towards any USMLE Step 1 Smart Banker bundle. And of course, if you love to try before you buy, TrueLearn does offer a completely free Smart Bank trial that you can access simply by visiting TrueLearn.com, navigating to the USMLE Step 1 product. Lastly, if you haven't already done so, do mark your calendars for session 2 that's coming up, titled Beyond the Basics. That will be happening on Tuesday, April 18th, same time, 8 p.m. Eastern Time. On behalf of TrueLearn and our presenter, thanks so much for joining us.